Welcome to the presentation on toilet training for children with disabilities from a therapist's perspective. As therapists, we play a crucial role in supporting children with disabilities in various aspects of their development, including toilet training. This presentation aims to equip therapists with effective strategies and insights to facilitate toilet training success for children with disabilities. We understand the unique challenges and considerations involved in toilet training for this population, and our goal is to provide practical guidance that aligns with evidence-based practices and individualized approaches. By sharing our expertise and experiences, we aim to empower therapists to create tailored intervention plans that address the specific needs and abilities of each child, ultimately promoting independence, confidence, and improved quality of life. Together, we can work towards helping children with disabilities achieve success in this important aspect of their daily lives. Understanding disabilities is crucial when addressing toilet training challenges. Autism spectrum disorder, ASD, often entails difficulties with communication, sensory processing, and social interaction, which can impact toilet training readiness and progress. Children with ASD may struggle with understanding social cues related to toileting, sensory sensitivities to certain textures or sounds in the bathroom environment, and difficulty in expressing their needs effectively. Similarly, cerebral palsy, CP, presents motor impairments that can affect mobility, coordination, and muscle control, posing challenges in achieving proper positioning on the toilet and mastering the physical aspects of toileting. Moreover, intellectual disabilities encompass a wide range of cognitive impairments that may affect understanding, memory, and learning abilities, leading to delays in grasping toilet training concepts and routines. Individuals with intellectual disabilities may require simplified instructions, repetition, and additional support to acquire toileting skills effectively. Each disability presents unique challenges and considerations, highlighting the importance of individualized approaches and targeted interventions tailored to the specific needs of each child. Therapists must recognize the multifaceted nature of disabilities when addressing toilet training interventions. By understanding the specific challenges associated with conditions such as ASD, CP, and intellectual disabilities, therapists can develop targeted strategies to support children in achieving toilet training success. This may involve incorporating visual supports and social stories for children with ASD to enhance understanding, implementing adaptive equipment and positioning techniques for children with CP to optimize comfort and stability, and providing simplified instructions and repetition for children with intellectual disabilities to facilitate learning and retention. Furthermore, therapists must collaborate closely with caregivers and other professionals involved in the child's care to ensure a holistic and coordinated approach to toilet training. By tailoring interventions to address the unique needs and abilities of each child, therapists can help promote independence, confidence, and dignity in toileting for children with disabilities. Toilet training plays a critical role in fostering children's independence, self-esteem, and social inclusion. Mastering toileting skills empowers children to take control of their bodily functions and engage more fully in daily activities without relying on constant assistance. As children develop proficiency in toileting, they gain a sense of autonomy and confidence in managing their personal hygiene needs, contributing to positive self-esteem and self-image. Moreover, successful toilet training facilitates social inclusion by enabling children to participate more comfortably in social interactions, activities, and environments where toileting skills are essential, such as school, daycare, and community outings. By mastering toileting skills, children with disabilities can overcome barriers to social participation and build meaningful connections with peers, fostering a sense of belonging and acceptance within their social circles. Therapists play a pivotal role in supporting children with disabilities in developing toileting skills and achieving toilet training success. Through their expertise in child development, behavior management, and adaptive techniques, therapists can assess individual needs, identify barriers to toileting progress, and implement tailored interventions to address specific challenges. Therapists work collaboratively with children, caregivers, and other professionals involved in the child's care to create comprehensive intervention plans that promote independence, confidence, and dignity in toileting. Whether through teaching adaptive strategies, providing sensory integration techniques, or addressing behavioral concerns, therapists play a crucial role in empowering children with disabilities to overcome obstacles and achieve optimal outcomes in toileting. By providing guidance, support, and advocacy, therapists contribute to enhancing the quality of life and overall well-being of children with disabilities as they navigate the journey of toilet training. Toilet training plays a critical role in fostering children's independence, self-esteem, and social inclusion. Mastering toileting skills empowers children to take control of their bodily functions and engage more fully in daily activities without relying on constant assistance. As children develop proficiency in toileting, they gain a sense of autonomy and confidence in managing their personal hygiene needs, contributing to positive self-esteem and self-image. Moreover, successful toilet training facilitates social inclusion by enabling children to participate more comfortably in social interactions, activities, and environments where toileting skills are essential, such as school, daycare, and community outings. By mastering toileting skills, children with disabilities can overcome barriers to social participation and build meaningful connections with peers, fostering a sense of belonging and acceptance within their social circles. Therapists play a pivotal role in supporting children with disabilities in developing toileting skills and achieving toilet training success. Through their expertise in child development, behavior management, and adaptive techniques, therapists can assess individual needs, identify barriers to toileting progress, and implement tailored interventions to address specific challenges. Therapists work collaboratively with children, caregivers, and other professionals involved in the child's care to create comprehensive intervention plans that promote independence, confidence, and dignity in toileting. Whether through teaching adaptive strategies, providing sensory integration techniques, or addressing behavioral concerns, therapists play a crucial role in empowering children with disabilities to overcome obstacles and achieve optimal outcomes in toileting. By providing guidance, support, and advocacy, therapists contribute to enhancing the quality of life and overall well-being of children with disabilities as they navigate the journey of toilet training. Conducting a thorough assessment of a child's abilities, challenges, and readiness for toilet training is crucial for developing effective intervention plans. Assessment helps therapists and caregivers understand the child's current level of functioning, identify specific areas of strength and difficulty, and determine the most appropriate strategies and supports needed to promote successful toilet training outcomes. A comprehensive assessment typically includes evaluating the child's cognitive, motor, sensory, communication, and social-emotional skills relevant to toileting. This may involve observing the child's behavior during toileting-related activities, assessing their understanding of toileting concepts and routines, and exploring any sensory sensitivities or motor impairments that may impact toileting success. Additionally, assessing the child's readiness for toilet training involves identifying signs of readiness such as showing interest in the toilet, demonstrating bladder and bowel control, and being able to follow simple instructions related to toileting tasks. In conducting toilet training assessments, therapists may utilize a variety of tools and techniques to gather relevant information and inform intervention planning. These may include standardized assessments, such as developmental scales, functional assessments, or behavioral checklists, to evaluate the child's toileting skills and identify areas needing support or improvement. Functional assessments may involve structured observations of the child's toileting behaviors in naturalistic settings, such as at home or in school, to assess their ability to independently perform toileting tasks and follow toileting routines. Additionally, therapists may use informal assessments, such as interviews with caregivers or direct observations of the child's toileting behaviors, to gather qualitative data about the child's toileting habits, preferences, and challenges. By conducting a comprehensive assessment of the child's toileting abilities and readiness, therapists can develop targeted intervention plans that address the child's unique needs and promote successful toilet training outcomes. Individualized treatment planning is essential for toilet training success, as it allows therapists to address each child's unique needs and abilities effectively. Every child with disabilities presents with their own set of challenges, strengths, and preferences, requiring personalized approaches to toilet training interventions. By conducting thorough assessments and gathering information about the child's developmental level, sensory sensitivities, communication skills, and motor abilities, therapists can identify areas of focus and design tailored intervention plans. These plans may include strategies such as visual supports, sensory integration techniques, adaptive equipment, and behavior management strategies, adapted to meet the child's specific needs and learning style. Additionally, individualized treatment planning ensures that interventions are meaningful, relevant, and achievable for the child, increasing their engagement and motivation in the toilet training process. Collaboration with caregivers and other professionals is integral to the development of comprehensive treatment goals for toilet training. Caregivers play a vital role in supporting the child's toileting development at home, providing valuable insights into the child's routines, preferences, and challenges. By collaborating with caregivers, therapists can gain a deeper understanding of the child's toileting habits and identify opportunities for intervention and support within the home environment. Furthermore, collaboration with other professionals involved in the child's care, such as educators, physicians, and occupational therapists, ensures a holistic approach to toilet training that addresses the child's needs across different settings and contexts. Together, therapists, caregivers, and other professionals can develop treatment goals that are realistic, achievable, and aligned with the child's overall developmental trajectory, promoting success and independence in toileting skills. Sensory processing issues can significantly impact toileting behaviors and success during toilet training for children with disabilities. Children with sensory sensitivities may experience discomfort or distress in the bathroom environment due to sensory stimuli such as bright lights, loud sounds, or unfamiliar textures. This discomfort can lead to resistance or avoidance behaviors during toileting, making it challenging for children to participate in toilet training routines effectively. Additionally, sensory processing issues may affect the child's ability to recognize and respond to bodily sensations related to bladder and bowel control, further complicating the toilet training process. To address these challenges, therapists can implement sensory-friendly strategies and environmental modifications to create a more comfortable and supportive toileting environment. This may include using soft lighting, providing calming sensory input through weighted blankets or sensory toys, and incorporating familiar textures or scents into toileting routines to promote relaxation and reduce sensory overload. Furthermore, therapists can employ sensory integration techniques to help children regulate their sensory experiences and improve their ability to participate in toileting tasks. These techniques may include deep pressure activities, proprioceptive input, and vestibular stimulation to promote body awareness, coordination, and self-regulation during toileting. By addressing sensory challenges proactively and incorporating sensory-friendly strategies into toilet training interventions, therapists can help children with disabilities feel more comfortable and confident in the bathroom environment, ultimately promoting success and independence in toileting skills. Additionally, educating caregivers about the impact of sensory processing issues on toileting behaviors and providing them with strategies to support their child's sensory needs during toilet training can further enhance the effectiveness of interventions and promote positive outcomes. Behavioral strategies are instrumental in addressing common challenges encountered during toilet training for children with disabilities. Non-compliance and resistance are frequent obstacles that therapists may encounter when working with these children. To address non-compliance, therapists can implement techniques such as positive reinforcement, shaping, and prompting. Positive reinforcement involves rewarding desired behaviors, such as using the toilet or following toileting routines, with praise, tokens, or preferred activities, to motivate the child and increase the likelihood of repeated behaviors. Shaping involves breaking down the toilet training process into small, manageable steps and gradually reinforcing each step until the child achieves the desired outcome. Additionally, therapists can use prompting techniques, such as verbal prompts, visual cues, or physical guidance, to prompt the child to engage in toileting behaviors and provide support as needed. In addressing resistance during toilet training, therapists can employ strategies such as desensitization, gradual exposure, and choice-making. Desensitization involves gradually exposing the child to the toilet training process and associated stimuli, such as the bathroom environment or toileting routines, in a controlled and supportive manner to reduce anxiety and resistance. Therapists can also use gradual exposure techniques to introduce new toileting tasks or skills slowly, allowing the child to become accustomed to changes and build confidence over time. Additionally, offering choices and opportunities for autonomy during toileting, such as selecting preferred toilet training materials or choosing a preferred toilet seat, can help empower the child and reduce resistance by giving them a sense of control over their toileting experience. By employing these behavioral strategies and techniques, therapists can address non-compliance and resistance effectively, promote cooperation and engagement in toileting tasks, and facilitate successful toilet training outcomes for children with disabilities. Communication and social skills play crucial roles in toilet training for children with disabilities. Effective communication allows children to express their needs, understand instructions, and communicate their preferences related to toileting. Additionally, social skills are essential for navigating social interactions and understanding social norms surrounding toileting behaviors. Children with disabilities may face challenges in these areas, impacting their ability to participate in toilet training routines effectively. Therapists can support children in developing communication skills by using visual supports, augmentative and alternative communication (AAC) devices, and social narratives to enhance understanding and expression related to toileting. Visual supports, such as picture schedules, social stories, and visual cues, can help children with disabilities understand toileting routines, sequence of steps, and expected behaviors. AAC devices, such as communication boards or speech-generating devices, can assist children who have difficulty communicating verbally in expressing their toileting needs and preferences. Additionally, therapists can use social narratives to teach children about appropriate toileting behaviors, social expectations, and the importance of privacy and personal hygiene. Moreover, therapists can facilitate the development of social skills by incorporating peer modeling, role-playing, and social reinforcement into toilet training interventions. Peer modeling involves providing opportunities for children to observe and imitate peer behaviors related to toileting, promoting social learning and imitation skills. Role-playing activities allow children to practice toileting routines, social scripts, and problem-solving strategies in a safe and supportive environment, enhancing their social competence and confidence. Furthermore, therapists can use social reinforcement, such as praise, encouragement, and positive feedback from peers and caregivers, to reinforce desired toileting behaviors and promote social interaction during toilet training sessions. By addressing communication and social skills in toilet training interventions, therapists can help children with disabilities overcome barriers to successful toileting, improve their social competence, and promote independence and confidence in toileting skills. Adaptive equipment and environmental modifications are instrumental in supporting children with disabilities to achieve toileting independence. Various tools and modifications can be utilized to create a supportive and accessible environment tailored to the child's needs. For example, raised toilet seats, toilet frames, and grab bars can provide stability and support for children with mobility impairments or balance difficulties. Additionally, adaptive toilet seats with built-in handles or adjustable heights can accommodate children at different sizes and physical abilities. Environmental modifications, such as installing handrails, non-slip mats, and adequate lighting in the bathroom, can enhance safety and accessibility for children with sensory sensitivities or visual impairments. Furthermore, providing sensory-friendly toileting materials, such as soft toilet paper or fragrance-free soap, can help create a comfortable and soothing toileting experience for children with sensory processing issues. Therapists play a critical role in assessing the child's needs and recommending appropriate adaptive equipment and environmental modifications to support toileting independence. Through comprehensive assessments, therapists can identify the child's specific challenges and limitations related to toileting, such as physical impairments, sensory sensitivities, or cognitive delays. Based on this assessment, therapists can then collaborate with caregivers and other professionals to select and implement tailored solutions that address the child's unique needs and promote success in toileting tasks. Therapists may recommend a range of adaptive equipment, including toilet seat risers, step stools, handrails, and specialized toileting aids, based on the child's individual requirements and functional abilities. Additionally, therapists can provide guidance on environmental modifications, such as bathroom layout adjustments, lighting enhancements, and sensory-friendly enhancements, to create a supportive and inclusive toileting environment that facilitates independence and confidence for children with disabilities. Functional mobility and positioning are essential considerations in toilet training for children with disabilities, as they directly impact the child's ability to access and use the toilet independently. Proper mobility and positioning enable children to achieve optimal body alignment, balance, and stability during toileting tasks, facilitating successful participation and reducing the risk of falls or accidents. Children with mobility impairments, such as those with cerebral palsy or muscular dystrophy, may face challenges in transferring onto the toilet, maintaining balance while seated, or reaching for toilet paper or hygiene items. Additionally, children with sensory sensitivities or motor coordination difficulties may struggle with coordinating movements and adjusting their body position effectively on the toilet. By addressing functional mobility and positioning, therapists can help children develop the necessary skills and techniques to navigate toileting tasks safely and independently, promoting confidence and autonomy in toileting behaviors. Therapists can employ various strategies to address mobility and positioning challenges during toilet training, tailored to the child's specific needs and abilities. For children with mobility impairments, therapists may recommend using adaptive equipment such as toilet seat risers, grab bars, or toilet frames to provide stability and support during transfers and toileting tasks. Additionally, therapists can teach children proper body mechanics and transfer techniques to facilitate safe and efficient movements onto and off the toilet. Furthermore, therapists can work with caregivers to establish consistent toileting routines and positioning techniques that promote optimal body alignment and comfort for the child. By incorporating strategies to address functional mobility and positioning into toilet training interventions, therapists can empower children with disabilities to overcome barriers and achieve success in toileting tasks, promoting independence and confidence in self-care skills. Continence management is a crucial aspect of caring for children with disabilities, as many may experience challenges related to bladder and bowel control. Strategies for managing continence issues vary depending on the underlying cause and the child's specific needs. For children with disabilities such as cerebral palsy or spina bifida, bladder and bowel management techniques may include scheduled toileting routines, timed voiding schedules, and prompted voiding strategies to help regulate bladder and bowel function. These techniques aim to establish regular habits and prevent accidents by prompting the child to use the toilet at designated times throughout the day. Additionally, therapists and caregivers may implement dietary modifications, fluid management strategies, and medication management protocols to address underlying medical conditions that contribute to continence issues. Furthermore, for children with more complex continence challenges, such as those with neurogenic bladder or fecal incontinence, specialized interventions may be necessary. These may include catheterization techniques, bowel management programs, and pelvic floor exercises to promote bladder and bowel function and manage incontinence effectively. Catheterization may involve intermittent catheterization or indwelling catheterization to empty the bladder regularly and prevent urinary retention. Bowel management programs may include bowel training techniques, dietary modifications, and the use of stool softeners or laxatives to regulate bowel movements and promote continence. By implementing comprehensive continence management strategies, therapists and caregivers can help children with disabilities achieve optimal bladder and bowel function, minimize accidents, and improve their quality of life. Collaborating with caregivers is paramount in the toilet training process for children with disabilities, as they play a central role in supporting the child's development and progress. Caregivers possess valuable insights into the child's daily routines, preferences, and challenges, making their involvement essential for tailoring interventions to the child's individual needs. Therapists can engage caregivers by providing education and guidance on effective toileting strategies, such as creating structured routines, implementing positive reinforcement techniques, and addressing sensory sensitivities or behavioral challenges. Additionally, therapists can empower caregivers to recognize signs of readiness for toilet training, establish consistent toileting routines at home, and reinforce skills learned during therapy sessions. By collaborating closely with caregivers, therapists can ensure continuity of care, reinforce intervention strategies across settings, and promote generalization of toileting skills beyond the therapy environment. Furthermore, involving caregivers in treatment planning and implementation fosters a collaborative and supportive approach to toilet training that enhances the child's overall progress and success. Therapists can encourage open communication with caregivers, soliciting feedback on the child's progress, concerns, and goals related to toileting. Additionally, therapists can provide caregivers with resources, such as visual schedules, social stories, and behavior management techniques, to support their active involvement in the toilet training process. By empowering caregivers to play an active role in treatment planning and implementation, therapists promote a sense of ownership and investment in the child's development and well-being. Ultimately, by working together as a team, therapists and caregivers can maximize the child's potential for achieving independence and success in toileting skills, fostering confidence and dignity in their self-care abilities. Transitioning toileting skills to different environments is a critical aspect of toilet training for children with disabilities, as it promotes consistency and independence across various settings. Therapists can support children in navigating these transitions by collaborating with educators, caregivers, and other professionals to create a seamless toileting routine that can be implemented across different environments. Strategies may include developing individualized toileting schedules and visual supports to familiarize the child with the new environment and establish clear expectations for toileting. Additionally, therapists can provide training and guidance to school staff or daycare providers on the child's toileting needs, preferences, and any adaptive equipment or techniques required to support their independence. By fostering collaboration and communication among all stakeholders, therapists can ensure that the child receives consistent support and reinforcement for toileting skills across different environments, facilitating successful transitions and promoting continuity of care. Moreover, therapists can empower children with disabilities to self-advocate for their toileting needs and preferences when transitioning to different environments. By teaching children how to communicate their toileting routines, preferences, and any accommodations they may require, therapists promote self-awareness and self-advocacy skills that empower children to take ownership of their toileting independence. Additionally, therapists can work with caregivers and school personnel to identify and address any environmental barriers or accessibility concerns that may impact the child's toileting experience in different settings. By promoting collaboration, communication, and self-advocacy skills, therapists can help children with disabilities navigate transitions to different environments with confidence and success, ultimately fostering independence and dignity in their toileting routines. Addressing behavioral regression in toilet training requires therapists to approach the situation with understanding and support. Regression in toileting behaviors can occur for various reasons, including changes in routine, stress, or underlying emotional or developmental factors. Therapists can first assess the underlying cause of the regression by engaging in open communication with the child and caregivers to identify any triggers or stressor that may be contributing to the behavior. Once the root cause is identified, therapists can implement strategies to address the regression in a supportive manner. This may involve providing reassurance and positive reinforcement to the child, acknowledging their feelings and concerns, and offering additional support and guidance as needed. By creating a supportive and non-judgmental environment, therapists can help the child feel safe and secure in expressing their needs and working through the regression in toileting behaviors. Furthermore, therapists can collaborate with caregivers to develop a structured plan for addressing behavioral regression in toilet training. This plan may include implementing consistent routines, setting realistic expectations, and gradually reintroducing toileting tasks in a supportive and encouraging manner. Therapists can also provide caregivers with strategies for managing challenging behaviors, such as using positive reinforcement, offering choices, and providing sensory supports to help alleviate stress and anxiety. Additionally, therapists can offer ongoing support and guidance to both the child and caregivers as they work through the regression, monitoring progress and adjusting interventions as needed. By working together as a team and providing consistent support and understanding, therapists can help children overcome behavioral regression in toilet training and continue to progress towards independence and success in toileting skills. Positive reinforcement and motivation play pivotal roles in toilet training for children with disabilities, as they help encourage desired behaviors and foster a positive toileting experience. By using positive reinforcement techniques, therapists can reward and reinforce successful toileting behaviors, such as using the toilet independently or following toileting routines, to motivate children and increase the likelihood of repeated behaviors. Positive reinforcement may include verbal praise, high fives, stickers, tokens, or preferred activities or rewards that are meaningful to the child. By consistently providing positive reinforcement for desired behaviors, therapists can help build the child's confidence, self-esteem, and motivation to participate in toileting tasks actively. Additionally, therapists can incorporate motivational strategies, such as setting achievable goals, celebrating successes, and tracking progress, to inspire children and keep them engaged and motivated throughout the toilet training process. Furthermore, therapists can collaborate with caregivers to establish a reinforcement system that is tailored to the child's preferences and interests. Caregivers can play an active role in providing reinforcement and motivation by offering praise, rewards, or incentives for successful toileting behaviors at home. Additionally, therapists can encourage caregivers to create a visual reinforcement chart or reward system that allows the child to track their progress and earn rewards for reaching specific toileting goals. By involving caregivers in the reinforcement process, therapists can reinforce consistency across different settings and promote generalization of toileting skills. Moreover, therapists can teach caregivers strategies for using positive reinforcement effectively, such as providing immediate feedback, varying reinforcement strategies, and gradually fading reinforcement over time as the child's toileting skills improve. By implementing these strategies, therapists can create a supportive and motivating environment that encourages children with disabilities to achieve success and independence in toileting skills. Data collection and progress monitoring are essential components of effective toilet training for children with disabilities, as they provide valuable insights into the child's progress, identify areas of improvement, and inform adjustments to treatment plans. By systematically collecting data on toileting behaviors, therapists can track the frequency, duration, and success of toileting attempts, as well as any challenges or barriers encountered during the process. This data allows therapists to identify patterns, trends, and areas of concern, helping to tailor interventions to the child's specific needs and abilities. Additionally, progress monitoring enables therapists to evaluate the effectiveness of intervention strategies over time and make evidence-based decisions about adjustments or modifications to the treatment plan as needed. By regularly collecting and analyzing data, therapists can ensure that toileting interventions are individualized, targeted, and responsive to the child's progress and changing needs. Therapists can use a variety of tools and techniques for tracking progress and collecting data during toilet training interventions. This may include structured observation tools, such as behavior logs or checklists, to record toileting behaviors and outcomes systematically. Additionally, therapists may use functional assessments, such as toileting trials or bladder diaries, to gather quantitative data on the child's bladder and bowel function and monitor changes over time. Furthermore, therapists can involve caregivers in data collection by providing them with tracking sheets or apps to record toileting attempts and outcomes at home. By incorporating data collection into the toilet training process, therapists can promote collaboration, communication, and accountability among all stakeholders, facilitating a comprehensive and evidence-based approach to achieving toileting success for children with disabilities. Multidisciplinary collaboration is essential for supporting children with disabilities in achieving toilet training success, as it allows for a comprehensive and coordinated approach that addresses the child's diverse needs across various domains. Collaborating with professionals from different disciplines, such as pediatricians, educators, and occupational therapists, ensures that all aspects of the child's development and well-being are considered in the toilet training process. Pediatricians can provide valuable medical insights into any underlying conditions or health concerns that may impact toileting, as well as offer guidance on medication management or dietary interventions. Educators can contribute to the development of consistent toileting routines and strategies that can be implemented at school or daycare, promoting continuity of care and generalization of skills across different settings. Occupational therapists can offer expertise in sensory integration, motor skills development, and adaptive equipment, helping to address sensory sensitivities, motor impairments, and environmental barriers that may affect toileting independence. Therapists can facilitate multidisciplinary collaboration by establishing clear communication channels, sharing relevant assessment findings and progress reports, and coordinating interventions and treatment plans with other professionals involved in the child's care. Additionally, therapists can participate in interdisciplinary team meetings, case conferences, or collaborative care planning sessions to discuss the child's toileting goals, share expertise, and brainstorm innovative solutions to address complex challenges. By fostering collaboration and teamwork among all stakeholders, therapists can ensure that the child receives comprehensive, holistic, and individualized support that maximizes their potential for success and independence in toileting skills. Moreover, multidisciplinary collaboration promotes a shared understanding of the child's strengths, needs, and goals, fostering a supportive and inclusive environment that prioritizes the child's well-being and quality of life. Cultural factors significantly influence toilet training practices and beliefs, as they shape families' attitudes, values, and traditions surrounding toileting behaviors. Cultural variations in toilet training may include differences in timing, methods, and expectations for achieving toileting independence. For example, some cultures may prioritize early initiation of toilet training, while others may follow more gradual and child-led approaches. Additionally, cultural beliefs about modesty, cleanliness, and privacy may influence the way toileting tasks are taught and practiced within the family. Moreover, cultural norms regarding parenting roles, family dynamics, and social support networks may impact caregivers' perceptions of their role in facilitating toilet training and their willingness to seek professional guidance or support. Given the diversity of cultural beliefs and practices surrounding toilet training, it is crucial for therapists to approach their work with cultural competence and sensitivity. Cultural competence involves understanding and respecting the cultural backgrounds, values, and preferences of the families with whom therapists work. By acknowledging and valuing cultural diversity, therapists can build trust, rapport, and mutual respect with families, creating a safe, supportive environment for collaboration. Moreover, cultural competence enables therapists to tailor their interventions and recommendations to align with families' cultural beliefs and practices, promoting acceptance and adherence to intervention strategies. By incorporating cultural competence into their practice, therapists can enhance the effectiveness of toilet training interventions, strengthen therapeutic relationships, and promote positive outcomes for children and families from diverse cultural backgrounds. Empowering children and families in the toilet training process is essential for promoting independence and confidence. Therapists can employ various strategies to empower children by fostering a sense of autonomy and self-efficacy in toileting tasks. This may include involving children in decision-making processes, allowing them to choose their preferred toilet seat or toileting materials, and offering opportunities for them to practice self-help skills, such as pulling down pants or wiping independently. By encouraging children to take an active role in their toileting routines, therapists promote a sense of ownership and control over their own bodies and actions, fostering independence and self-confidence in toileting skills. Additionally, therapists can empower families by providing education, support, and resources to help them navigate the toilet training process with confidence and competence. This may involve offering guidance on effective toileting strategies, problem-solving techniques, and behavior management strategies tailored to the child's needs and family's cultural preferences. Moreover, therapists can advocate for families by collaborating with other professionals, such as educators, pediatricians, and community resources, to ensure that families have access to the support and services they need to promote successful toilet training outcomes. By empowering both children and families, therapists can promote a collaborative and strengths-based approach to toilet training that fosters independence, confidence, and well-being for all involved. Addressing family concerns and managing expectations related to toilet training is crucial for ensuring a collaborative and supportive approach. Therapists can begin by creating an open and non-judgmental space where caregivers feel comfortable expressing their concerns, anxieties, and expectations regarding toilet training. By actively listening to caregivers' perspectives, therapists can gain insight into their unique challenges, cultural beliefs, and past experiences with toilet training, allowing for a more personalized and empathetic approach to intervention. Therapists can then provide education and guidance to address common concerns and misconceptions surrounding toilet training, such as the ideal age to start, the duration of the process, and the role of accidents in learning. By offering evidence-based information and realistic expectations, therapists can help caregivers develop a clearer understanding of the toilet training process and feel more confident and empowered in supporting their child's development. Furthermore, therapists can collaborate with families to develop realistic and achievable goals for toilet training that align with the child's individual needs and family's values and preferences. This may involve discussing the child's current abilities, challenges, and readiness for toilet training, as well as considering any cultural or environmental factors that may influence the process. Therapists can then work with caregivers to create a flexible and personalized plan that takes into account the child's pace of learning, strengths, and areas needing support. By involving caregivers in goal-setting and decision-making processes, therapists foster a sense of partnership and empowerment, promoting a collaborative and positive approach to toilet training that focuses on the child's well-being and development. Supporting therapists' self-care and preventing burnout is essential when working with children with disabilities and their families, especially in demanding tasks such as toilet training. Therapists can prioritize their well-being by establishing healthy boundaries, practicing self-awareness, and seeking support from colleagues and supervisors when needed. Setting realistic expectations and managing workload effectively can help therapists maintain a healthy work-life balance and prevent burnout. Additionally, engaging in self-care activities, such as exercise, mindfulness practices, hobbies, and spending time with loved ones, can replenish energy levels and reduce stress. By taking care of their physical, emotional, and mental health, therapists can sustain their passion and commitment to supporting children and families through the toilet training process. Furthermore, creating a supportive work environment that fosters open communication, collaboration, and teamwork can contribute to therapists' well-being and resilience. Supervisors and colleagues can offer peer support, mentorship, and debriefing opportunities to help therapists process challenging cases and cope with stressor effectively. Additionally, organizations can provide training and resources on self-care and stress management techniques to equip therapists with tools and strategies for maintaining resilience in their work. By prioritizing self-care and promoting a culture of support and well-being within the workplace, therapists can sustain their passion for helping children with disabilities and their families, ensuring that they can continue to provide high-quality care and support throughout the toilet training journey. Case studies offer valuable insights into successful approaches to toilet training for children with disabilities, highlighting the importance of individualized and comprehensive interventions. In one case study, a child with autism spectrum disorder, ASD, demonstrated significant resistance to toilet training due to sensory sensitivities and communication difficulties. The therapist implemented a multifaceted approach that included sensory integration techniques, visual supports, and positive reinforcement strategies. By gradually desensitizing the child to toileting-related stimuli and providing consistent praise and rewards for successful toileting attempts, the child made notable progress in developing toileting skills and gained confidence in using the toilet independently. This case underscores the importance of addressing sensory and communication challenges in toilet training interventions for children with ASD, as well as the effectiveness of a holistic and individualized approach in promoting success. In another case study, a child with cerebral palsy faced mobility impairments that posed significant barriers to toilet training. The therapist collaborated closely with the child's caregivers and occupational therapist to develop a tailored intervention plan that focused on improving functional mobility and positioning during toileting tasks. Through targeted exercises, adaptive equipment, and environmental modifications, the child gained greater independence and confidence in accessing the toilet and performing toileting tasks. This case highlights the importance of addressing physical limitations and mobility challenges in toilet training interventions for children with cerebral palsy, as well as the value of interdisciplinary collaboration in optimizing outcomes. Overall, these case studies underscore the importance of individualized, multidisciplinary approaches to toilet training for children with disabilities, as well as the effectiveness of addressing underlying factors and barriers to promote success and independence. Open the floor for questions and discussion on toilet training strategies for children with disabilities. Therapists can benefit from a range of resources and references to deepen their understanding and enhance their practice in toilet training for children with disabilities. Books such as The Ultimate Guide to Toilet Training Children with Special Needs, by Dr. Eileen Bailey, and Toilet Training for Individuals with Autism or Other Developmental Issues, by Maria Wheeler, offer comprehensive insights into effective strategies and techniques tailored to the unique needs of children with disabilities. Additionally, scholarly articles such as Toilet Training Children with Autism and Other Developmental Disabilities, A Critical Review, by Azran et al., and Toilet Training Individuals with Autism and Other Developmental Disabilities, A Critical Review, by LeBlanc et al., provide evidence-based approaches and research findings to inform clinical practice. Furthermore, websites such as the Autism Speaks Toilet Training Toolkit and the National Autistic Society offer practical tips, visual supports, and downloadable resources for therapists, caregivers, and educators working with children with autism spectrum disorder and other developmental disabilities. Moreover, professional organizations such as the American Occupational Therapy Association, AOTA, and the American Physical Therapy Association, APTA, offer practice guidelines, continuing education courses, and online resources on toileting interventions for children with disabilities. Additionally, online platforms such as PubMed, Google Scholar, and ResearchGate provide access to a wealth of peer-reviewed research articles, case studies, and clinical practice guidelines on toilet training and related topics. By utilizing these resources and references, therapists can stay informed about the latest evidence-based practices, expand their knowledge base, and enhance their ability to support children with disabilities and their families in achieving toileting success. Professional development opportunities focused on toilet training and developmental disabilities offer therapists valuable avenues for enhancing their knowledge, skills, and expertise in supporting children and families. Workshops and conferences organized by professional associations, such as the American Occupational Therapy Association, AOTA, or the American Physical Therapy Association, APTA, often feature sessions dedicated to toileting interventions for children with disabilities. These events provide therapists with opportunities to learn from leading experts in the field, exchange ideas with peers, and gain practical insights into effective assessment and intervention strategies. Additionally, workshops and conferences may offer hands-on training, case studies, and interactive sessions that allow therapists to apply new knowledge and techniques to their clinical practice, promoting skill development and confidence in working with children with developmental disabilities. Furthermore, online courses and webinars provide convenient and accessible professional development opportunities for therapists seeking to enhance their expertise in toilet training and developmental disabilities. Platforms such as MedBridge, OT Potential, and Therapy Ed offer a wide range of courses on topics related to pediatric occupational therapy, physical therapy, and speech-language pathology, including toileting interventions for children with disabilities. These online resources enable therapists to learn at their own pace, from the comfort of their homes or offices, and access up-to-date information and evidence-based practices. By participating in professional development opportunities, therapists can stay current with best practices, expand their clinical toolkit, and ultimately improve outcomes for children and families affected by developmental disabilities. In conclusion, this presentation has provided therapists with valuable insights and strategies for supporting children with disabilities in achieving toileting independence. We have discussed the importance of understanding disabilities and how they may present unique challenges in toilet training, emphasizing the need for individualized treatment planning and multidisciplinary collaboration. Additionally, we explored various approaches to address sensory considerations, behavioral challenges, and communication skills in toilet training interventions. Through case studies, interactive activities, and resources, therapists have gained practical tools and techniques to enhance their practice and promote success in toileting skills for children with disabilities. As therapists, it is essential to apply the strategies and insights discussed in this presentation to our clinical practice actively. By incorporating evidence-based approaches, collaborating with families and other professionals, and continuing to seek professional development opportunities, we can effectively support children with disabilities in achieving toileting independence. Let us remain committed to empowering children and families, advocating for their needs, and fostering a supportive and inclusive environment that promotes dignity, autonomy, and well-being for all. Together, we can make a meaningful difference in the lives of children with disabilities and their families, ensuring that they receive the quality care and support they deserve on their journey to toileting success. Thank you for your participation and commitment to supporting children with disabilities in achieving toilet training success.